The piece I really want us to think about that I think is critically important in motivational interviewing is this concept of ambivalence and how we can use tools to resolve that, to help people engage in the health behaviors that we want them to engage in, and in this case, immunization and vaccines. And then in the off chance that you encounter resistance ever, how you would deal with that. Thanks for laughing, that was a joke. So, I think motivational interviewing is a way to help us work with patients. I think sometimes this is what we see. I think with the onset of COVID and the pandemic, we saw a lot more of this in healthcare, a lot of just combativeness among patients, a really active resistance. And it's defeating, it's exhausting, it leads to burnout from all levels of the healthcare system, and we need new tools, or we need to use different tools to get from this to this. Isn't this much nicer, right? Don't we all want to have this kind of encounter with healthcare professionals, with patients, and so on? So how do we do that? I think it starts with understanding what triggers behavior change. How do we get somebody who's not interested in vaccines to get vaccinated, right? So what we've thought, or the way that we've sort of approached things historically, is that we have to confront people, right? We have to give them the information to help them make the right decision, or what we believe is in their best interest. And that we can educate people into change, right? Sometimes we can. Sometimes that really people not engaging in the health behaviors that we want them to engage in is about a lack of knowledge. But sometimes it's more than that. And once we've provided the information, if the behavior continues not to change, there's something else going on. How many of you have met a smoker who did not know that smoking was bad for them? It's not a knowledge deficit, right? But they come in for health encounters with healthcare system and they get told over and over again that they should quit smoking, right? Because we got to check the box in the electronic health record or whatever. So we try to beat people with education, and it just doesn't work. What does help people change is when we can connect this behavior that we're interested in with the things that they value. That's what helps people think about changing. Ambivalence is common, right? What is ambivalence? Ambivalence is feeling one way about something and at the same time another way about something. If we can help people explore their ambivalence, we can help them move toward change. Nothing about that is educational. Nothing about that is imposing motivation from without. It's about helping people and eliciting from within themselves, which is very different from how many of us were trained in healthcare or population health to work with people. We talk to people, we tell them what to do, and then they're supposed to just do it. This is different. So this is a style of interacting with people that is collaborative. So we're both in this, or we're all in this. And it's centered on the patient or the person or the client. But it's goal-oriented, right? So I'm not pretending like I don't have an agenda. There's a goal we're trying to get to, but we're going to do this together. And really elicit that motivation from the person I'm talking to or the people I'm talking to, and really work with ambivalence. And again, this is a concept that was developed from the addiction literature, from alcohol use disorder literature, where the confrontational model was very prominent, right? There used to even be a show, I don't even know if it's still on, called Intervention, right? Where you take somebody with a substance use disorder, you'd surprise them in a room, and you would give them all the reasons they were behaving terribly and all the terrible consequences. You would confront them, you would give them the information, and they would miraculously change and go to rehab, and everything would be better. But we know through a lot of data and study that's just not how people make lasting change. So this is a different way. So usually when we think about working with people, we think about this concept here. I'm over here, the patient's over there, and we're going to talk about some things. Motivational interviewing, the interviewing piece, is about moving from this model to this model. Let me get next to you. Let me see this from your perspective, right? What do you see? I don't want to stand across from you. I want to be here to see what you see so that I can help guide change. So that's really conceptually what we're after here. So when we think about ambivalence, how many of you feel like you have some ambivalence about some things? You all do. Spoiler. So ambivalence is feeling two ways about something, right? I need to quit smoking, and smoking helps me cope with stress. I should take my medications, but there are other things I want to spend my money on or need to spend my money on. I trust my doctor. I don't trust the healthcare system. Those are ambivalence, right? How many of you feel great about your diet and exercise program currently? But you're not doing anything about it, or you haven't made those changes, so you must not be motivated, right? Or maybe you have reasons to want to change some of those things and reasons not to, right? I would love to get up and work out in the morning. I also love to sleep. I would love to eat fruits and vegetables all the time. I love a good greasy cheeseburger. That's ambivalence. There are reasons to change and reasons not to change. And it can look on the outside like unmotivated, but it's not. It's not an either or. Ambivalence exists on a continuum, right? So you can have faith in your physician or your healthcare team, but you can also have distrust of the system as a whole. I mean, it doesn't take a lot of looking at the bigger healthcare system to think, there's some sketchy stuff going on there, right? And then maybe not knowing, where does my doctor fit? Who wants me to get this vaccine? Is this something being pushed by these crooked pharmaceutical companies? What's going on here? Both things can be true, and it can fluctuate over time for patients, right? Sometimes feeling one way, sometimes feeling another, and that's how ambivalence works, and that's what we have to understand if we want to help patients make change, help people make change.